You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mother of four, and a teratogen information specialist. So what I do is talk to people, patients, providers, family members, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, or in cases of adoption. And an exposure can be anything. So it could be a chemical that you work with. It could be a prescription medication. It could even be cosmetics or a hair treatment. And usually, when people are asking about exposures, one of the things we think about is, can this exposure increase the chance of having a birth defect? So today, in honor of January being Birth Defects Awareness Month, we have two very special guests here with us to talk about birth defects across the lifespan. Tanya Williams, PhD, is an epidemiologist who works at the Centers for Disease Control and Prevention, what we call the CDC, as the scientific lead for the National Spina Bifida Patient Registry and the Umpire Protocol Project in the Birth Defects Monitoring and Research Branch, Division of Birth Defects and Infant Disorders. Sherry Farr, PhD, leads the Congenital Heart Defect Surveillance and Research at the National Center on Birth Defects and Developmental Disabilities at the CDC. Dr. Williams and Dr. Farr, thank you so much for being here and welcome to the show. So let's jump right in. I know we have a lot of great things to talk about. Can you explain more about this year's theme for Birth Defects Awareness Month? So the idea of birth defects awareness across the lifespan, and why a person who is pregnant or those planning to be pregnant or the providers that care for them, why would they be interested in knowing more about birth defects across the lifespan?
Yeah, Chris, birth defects are common conditions. They affect about 1 in every 33 babies born each year. People with birth defects of all ages are part of every community, and awareness is important for everyone.
That's right. We talk about birth defects across the lifespan because, thanks to improved medicine, we now see better survival. We are so thankful that more children born with birth defects grow up to lead full lives. The stages of life we are talking about are first, before and during the mother's pregnancy, and then the child's infancy, childhood, adolescence, and adulthood. The needs of a person with a birth defect changes throughout each of these stages. And increasing awareness of birth defects and their impact is the first step in promoting inclusion for all. So this month is a great opportunity to learn about different birth defects.
And of course, no two people with birth defects are exactly alike. Listening to and sharing stories from individuals and families impacted by birth defects helps us understand their experiences, it reduces stigma, and it highlights the need for lifelong care.
All really important, especially the ideas of inclusion and reducing that stigma around it. Why else is awareness about birth defects throughout the lifespan important?
Sharing information about birth defects and how they impact people's lives can help individuals, parents, and families affected by birth defects have the information they need to seek proper care. Hearing stories from other individuals with similar experiences can provide support and connection. as well as a possible glimpse into what to expect. And then listening to the needs and experiences of individuals and families can help highlight gaps or even barriers to proper healthcare. And awareness also helps healthcare professionals across specialties know how to best care for their patients with birth defects. Obstetricians, emergency medicine providers, and primary care providers all will care for patients with a birth defect. And understanding these patients' unique healthcare needs will help in that care. And increasing awareness also plays a part in ensuring resources are available from clinical and public health organizations. These can be for families who recently had a diagnosis, young adults transitioning away from home and their parents, or adults with birth defects considering starting their own families.
For example, a child born with a heart defect or spina bifida may need surgery soon after birth, but they also may need medical care throughout their life. Early intervention services and special education, speech therapy, and physical therapy can have a significant impact on a child's ability to learn new skills, overcome challenges, and increase success in school and in life.
And then as these children grow into teens and adults, they may need to change insurance or even providers, from their pediatric providers, both primary care doctors and specialists whom they may have known all their lives, to primary care doctors and specialists who treat adult patients. Teens may also become responsible for their own care decisions, and people may face new challenges in adulthood as well, such as increased risk of complications, maybe during their own pregnancies, or an increased risk of having a child with a birth defect. And they may also experience other conditions related to their birth defect. For instance, if you have a heart defect, you may have a higher risk of heart failure or even depression or anxiety.
For people living with spina bifida, some of these challenges can include that it's hard to get enough physical activity, there's a loss of mobility, and difficulty in finding jobs. Knowing about these challenges can help individuals with birth defects identify opportunities and resources that would help them thrive at all ages.
And I'm so glad that there's all this thought into this. You know, as you said, it's not a one and done. There may have been a surgery years ago, but of course, you know, people are growing and changing as they age, and having that lifelong approach can be very helpful for a lot of people. So what is the CDC doing to emphasize this lifelong approach to care?
The CDC and other public health organizations play a unique role in understanding common challenges and needs for people living with birth defects. By collecting data across populations, we can use those findings to inform care and treatment guidance to improve health outcomes for all people with birth defects. As an example, at CDC, we're doing this type of work for two types of birth defects, spina bifida and heart defects.
So let's start with spina bifida. Spina bifida is a major birth defect of the spine, which can include damage to the spinal cord and nerves and cause physical and intellectual disabilities. Kids with spina bifida also have problems urinating, which can lead to kidney damage. CDC is working with 9 spina bifida clinics across the country to develop a medical plan to safely and effectively monitor how well the bladder and kidneys are working in newborns and young children with spina bifida.
And CDC is also working to support people living with heart defects. Heart defects can vary from mild, such as a small hole in the heart, to severe, such as missing or poorly formed parts of the heart. And like individuals with spina bifida, children born with heart defects often require surgery in the first few years of life and specialized care throughout their lives.
Even with improved treatments early in life, most individuals with spina bifida or a congenital heart defect require specialized lifelong care. Ongoing appropriate medical care will help children and adults live as healthy a life as possible. CDC is conducting research to assess and address a broad array of needs as individuals age. Of note, CDC funds and manages the National Spina Bifida Patient Registry. The registry collects information from spina bifida patients of all ages, ranging from birth to 84 years of age, at 20 spina bifida clinics across the U.S. Data from the registry helps us better understand the care and services received and the relationships between medical procedures, health outcomes such as mobility and bladder health, and quality of life like social well-being. CDC shares the research findings with families, doctors, nurses, and other healthcare professionals, and works with spina bifida organizations to maximize the impact of our work.
And CDC funds several surveillance and research projects to learn more about people living with heart defects as well. In addition to looking at health outcomes, healthcare use, and racial ethnic differences in outcomes among children, adolescents, and adults with heart defects, we also survey adults living with heart defects and parents of children with heart defects to ask about their health, ask about any disabilities, their educational challenges, and their quality of life. And these surveys allow us to get a fuller picture of what life is like for people with heart defects. We've learned that many adults with heart defects are healthy and thriving. However, we've also learned that about 40% of adults with heart defects have a disability. And adults with heart defects are at increased risk of stroke, for example. With this knowledge, we can better be prepared with resources for individuals with heart defects and their families, as well as training for clinicians.
So what are some resources that are available for providers and for families?
CDC has several resources available on our website for both providers and families affected by birth defects. These include print materials and posters that provide information about birth defects, data, and research findings. We also have information on what to expect when navigating the healthcare system when you have a birth defect. There are tips for connecting with other families with similar experiences and links to partner organization websites that can offer more support.
And CDC, along with the American Academy of Pediatrics, also created the Congenital Heart Defects Toolkit for Physicians. And this toolkit provides video training, social media materials, customizable content for emails and newsletters, and conversation starters for primary care, obstetrician gynecologists, and emergency care doctors. These materials will increase awareness of heart defects among doctors and help ensure that people with heart defects get the lifelong congenital cardiac care they need. And all of these resources will be available in the show notes.
Absolutely, and on the CDC website as well. Dr. Farr, Dr. Williams, thank you so much for being with us today.
Thank you so much for having us and for highlighting birth defects across the lifespan.
It is our pleasure to continue to work with organizations like the CDC to bring awareness to things like Birth Defects Awareness Month. And as always, thank you to our audience for being part of today's show. That's going to be a wrap for us. But just remember, you can always listen to previous episodes of the podcast on Spotify, iTunes, or however you listen to podcasts. You can also hit subscribe so you never miss a new episode. And if you have an idea for the show, or if you would like to be on the show, we would love to hear from you. So feel free to email us at contact@mothertobaby.org. And of course, Mother to Baby is here to answer your questions. So you can reach us by phone at 866-626-6847. By text at 855-999-3525. You can visit us on our website, mothertobaby.org. From there, you can chat with us, or you can look at some of our other information. So we have blogs, we have fact sheets, and of course, we have a link to our podcasts. And until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.